Hello, and welcome to Mayor Kay's Monthly Forum. This month, I have some distinguished guests with me, and we're going to be talking about addiction, why it happens, the factors that impact recovery, and prevention efforts specifically in Weymouth. So welcome, my panel. I have a great group with me today, and our first guest is Dr. Kelly. Dr. Kelly, this is Dr. John Kelly, and he's the Associate Professor in Psychiatry at Harvard Medical School. He's also the Director of Addiction Recovery Management Service at Mass General Hospital and is the Associate Director for Mass General Center for Addiction Medicine. Welcome, Dr. Kelly, and thank you so much for coming.
My pleasure.
Also with us today is Jessica Goldberg. Hi, Jessica. Hello. Thank you for coming. And Jessica is the Community Health Specialist from the Regional Center for Healthy Communities in Cambridge. We've got some heavy hitters here today. And last but certainly not least is our own Lynn Frano, who is our Substance Abuse Coordinator for the town of Weymouth. Thanks for coming, Lynn. I really appreciate you coming.
Thank you, Mary Kay, for having us.
Dr. Kelly, you are the leading expert. I want to get right in on it, on addiction. You are certainly, in your field, you are very well known. Please begin by telling us about the effects of drugs on the brain.
Well, it's a pleasure to be here, and thank you for the invitation. Addiction, one of the reasons why we're here, of course, is that it's our nation's #1 public health problem. Addiction to alcohol, opiates, amphetamines, marijuana, these kinds of drugs confer a huge and enormous cost to society, both in terms of personal cost, healthcare costs, lost productivity, criminal justice, as well as economic cost. In terms of, right now what we're doing is costing our society every year approximately $750 billion.
My goodness.
So these are our best efforts right now, and this is the costs which have been steadily rising way above the cost of inflation, okay? So now how come all this is happening? Well, there are many different reasons for that. Now, one of the reasons is we've seen in Weymouth and in the Northeast region is excess availability to prescription drugs, and this has been a nationwide phenomenon. We know now that opiate overdose, for example, is the leading cause of accidental death in the United States. It has now surpassed motor vehicle accidents as the leading cause of accidental death.
Why do you think that's so, Doctor?
Well, as I mentioned, one of the reasons is the excess availability. We've had, there's two factors associated with increased prevalence of addiction and misuse of drugs is price and availability.
Yes.
Okay, so the more available a drug is, and if it has the potential to produce pleasure but also produce harm, then that substance will be consumed at a higher level. So the other factor is price. The cheaper something is the other factor that increases consumption.
Which is why it usually goes on to heroin addiction. You just spend just a very little time on opiates. What is an opiate?
What is an opiate?
And why is it categorized as opiates? And what type of drugs are opiates?
Well, opiates can be, when we're talking about prescribed drugs, they're things like Percocet, Vicodin, OxyContin. They're the brand names for those types of drugs. And as you mentioned, what happens is that the effects of those drugs, they're very seductive. Not in everybody, but among certain groups of people, the effects, because we know there are individual differences in sensitivity to reward.
Yes.
So some people find those drugs, when they're exposed to them, very rewarding, and they're likely to therefore repeat it and seek it out. For other people, it's kind of like, well, yeah, it makes me feel, I kind of like the effect, but I could take it or leave it. Other people actually find it aversive.
Yes.
So there's these individual differences to opiates. Now, one of the things that opiates, we have opiate receptors, natural opiate receptors in the brain, which produce pain-killing effects when we take an opiate. We have endogenous opiates that operate inside of our own brain, which help us kill pain. But we can also take opiates which come originally from poppies. They can be synthesized as well, that mimic those same effects. But because they produce effects that people like, euphoria, disinhibition, sedation, sleep, these kinds of effects, which can be appealing, as I mentioned, to many people.
Sure.
Not all people who take it, but
Doctor,
to
don't
many.
you think also when people, let's say, have some type of surgery, we're always going to have pain after the surgery is sent home and you're given pain pills. And usually if you're given pain medication and you're taking it for the pain, it seems to be okay. It's just, how do you know when to stop? And I think a lot of times a patient will say to me, well, I had something wrong with my leg and I just didn't know when to stop, because you want to feel good. But you're not feeling the pain. You don't really know, if you're on them, when that pain has stopped because of the medication or because you're healing. So I think that's part of it, at least what people tell me. That, geez, I'd like to take them all the time because it really makes me feel good. But, you know, if you're taking it for pain, we all want to feel good. We're a cushy society. So I don't know if that's ever been looked at as to the duration of time when you should take them. And
yeah, I mean, it's a good point, and I think it's important to make, you know, a distinction between dependence and addiction.
yes,
And you can become dependent on a drug. This isn't, what I'm saying now isn't always the way that these terms are used, but you can make this distinction based on this terminology, is that you can become, if you're, for example, the example you use where you have surgery in a hospital and you're placed on painkillers, right? So that does its job, it kills the pain. Now, that person in the hospital taking those over a period of weeks could become actually physiologically dependent on them.
I see.
But when they leave the hospital, they don't go and seek them out.
okay, I see the difference,
So,
sure.
and that would be someone who was actually engaged in drug-seeking behavior, where they find themselves psychologically addicted as well as the physiologically addicted. It's that combination.
Is there a procedure or something set in place where the surgeons or physicians know that, okay, don't take this any longer than, or it really depends on the individual, doesn't it?
Well, part of the problem has been is that there's been overprescription of opiates. So people have been prescribed large amounts really for a short-term pain problem. So they find themselves having a bottle of 30, 40, 50, 60 pills, and they only use 10 of them, and they keep them in their medicine cabinet.
Sure.
So this has happened over time, and this is one of the reasons, in part, why we've had this excess availability. If you ask young people where they got their first, pill, they'll say, I got it from a friend, or from, I got it from the medicine cabinet.
Sure.
Or they got it from a medicine cabinet from a friend. So they don't buy. Something like 70% of people actually get it from a friend to start with, who have gotten it from a medicine cabinet.
Has the AMA discussed this at all?
Yeah. Oh,
okay.
now this is on the radar screen now, nationally, federally, in all states, because the fact is that this has had such a dramatic impact. Now, we still need to do a lot more to bring this down, to bring down this epidemic that's happened, particularly with opiates. And Weymouth has been hard hit. Other communities have been hard hit by this. And it's preventable, that's the thing. But we haven't done enough to really go at it the way that we are going to need to, down the pike, down the road. But we have, and now it is on the radar screen federally and around the states. So.
And I know long-term problems usually occur during adolescence or young adulthood, and we have some numbers to indicate that 50% of the risk of addiction is generally genetically mediated. That's true?
Yeah.
And what are some other percentages?
Well, you can think about addiction as a disease of the brain. That is multifactorially determined.
I see.
So what that means is that's how doctors keep their jobs. They use terms like that. Nobody can really understand.
I'm
It makes them seem intelligent. But it means that there's a number of different factors which need to be there for somebody to become addicted. Now, genes is one of them. We know that certain people, just by virtue of their genetic makeup, have a higher risk. That explains about 50% of the risk for addiction.
Oh, I see.
So just the genes that you're born with. Now, that doesn't mean that you're going to become addicted. You have to have the other right conditions also.
Sure.
But obviously, that's a big factor, right?
Makes sense.
That really determines your response, how much you're going to like the effect of a drug, for example, like alcohol.
I see.
So we know that it has a strong genetic mediational component to it. How much you're affected by alcohol, how much you like it, how intoxicated you feel. That's all genetically mediated, and that will influence the risk of addiction. Now, that's not the only thing. There are other things like your developmental history, the nature of your upbringing, whether you've been exposed to trauma, whether you have just other kinds of challenges growing up, like if you have impulsivity problems, attentional problems, other kinds of anxiety or mood disorder problems. These also increase the risk. They're not necessary to become addicted, because people without those problems also become addicted, right?
But you're
So
covering
this is why
probably a big percentage of the population.
yeah, so this is why you can still get to this same endpoint and become addicted through all these different pathways, right? So this is what makes it complicated, and this is why we see, that's why a lot of people are at risk. And like I said before, there are different ways to come at it. One is from the public health and policy perspective.
Yes.
You decrease accessibility and availability, and you increase cost, right?
Yes.
So when you do those two things, consumption goes down. When you make it cheaper and more available, consumption of a substance goes up, to the extent that it can produce a positive subjective experience.
Sure. And is it true that 90% of adults with dependence start using before they're 18?
Yeah, yeah.
Wow.
So one of the things we've also learned is that there are critical periods of development. Okay, so why we have a drinking age, for example, of 21, right, is because, in part, now there's intoxicating effects of substances as well, which cause instant harm, right? But there's also a critical period of development in the brain which happens during your teen years.
I see.
So teenagers are particularly susceptible, the brains of teenagers are particularly susceptible to the effects of substances like marijuana, alcohol, opiates. And so if you can, and you can show this, if you drink, for example, before the age of 15, your risk of dependence, addiction to alcohol, is fourfold higher, independent of other factors.
And unfortunately, those are the years where they're going to experiment. Yeah.
Right, so it's very important from a prevention standpoint, if we want to reduce the incidence and prevalence of alcohol dependence, for example, in the population, which is our big problem out there, then we need to do a better job at prevention. So that means educating people and so on to prevent early exposure. The same has been shown actually with marijuana in studies, that marijuana during teen years is we think it's actually neurotoxic, but more specifically during those teenage years. And for teens who've used pretty regularly during their teen years, they have a different life course, where they have a substantial drop in their cognitive functioning over the whole course of their life, up till their mid-30s and 40s. So just using cannabis, marijuana during those teen years can have a lifelong effect in terms of reducing their cognitive ability, that is memory and attention. It will substantially reduce people's cognitive capacity to be able to cope with just their day-to-day life.
I see.
So much so, in fact, in studies where they've looked at this, other people actually notice it.
I see.
So it's observable from other people's standpoint. Yeah.
Which brings up a whole other series with medical marijuana, which we can talk about maybe later on. You said addiction is a disease of the brain, but we never really discuss it in that manner, do we? We never really talk about it being a mental illness or a brain factor.
Right.
What happens in the brain?
Yeah. Well, you're right. I mean, it's been talked about actually as a disease of the brain or a disease of the mind for at least 250 years.
Really?
And there are you can find documented instances of that actually being described by people who are close to this and clinically understand it and work with people who have become addicted. So it's not a new thing, but
I see.
There's been in the last 20 to 25 years, with what we've now, because with imaging technology, we can actually look and see inside people's brains. We used to be able to only do that on autopsies when people had died. We can get in their brain to find out what impact there was. But now you can actually see it with these imaging technologies, and you can see actually how the brain gets affected by addiction, and by exposure to alcohol and other drugs.
Wow.
And so so we've learned a lot more about the nature of the disease, how it affects the brain, how it changes the brain, how it kills brain cells. And so you can see the change, the shape of the brain actually changes, the structure of the brain changes, and the functional aspects of the brain changes. When you think about addiction really, you can think of it as your brain being hijacked by a drug. And this relates to this issue of stigma, because People, yes, they may choose to initiate a substance, but I have never met anybody who is an addict who says, yep, I wanted to become addicted to opiates or alcohol or whatever it is. Nobody ever says that.
Yeah.
And in fact, people desperately want to stop, and they find themselves unable to stop.
Yeah. Lately
Even
in the
despite
news,
very severe
you see a lot of, actors and famous people getting into trouble. And it's always, in addition to drugs, alcohol. It always seems to be a mix. That's a dangerous mix.
Mm-hmm. Yeah, for sure.
And lethal. Yikes. Any comments on all of our brain issues? Lynn, you good?
Yeah, I think Dr. Kelly, tell us what I know in the past I know when you did the narcotic misconceptions, you gave us a really good definition of addiction. Had to do with the pleasure centers of the brain. Can you explain that?
Well, let me see if I'm getting this right. One definition which I like is it's a disease of the brain characterized by impaired control over a reward-seeking behavior from which harm ensues.
Sure.
Okay, so impaired control over a reward-seeking behavior from which harm ensues. Okay, that's a nice kind of a pithy way of describing.
It's like my addiction to chocolate.
Yeah. And in your brain, actually, if you're addicted to chocolate or sex or gambling or alcohol or another drug, it is mediated through the same pathways in the brain, the same mesolimbic dopamine pathway in the middle of the brain, which extends from the middle stem of the brain up through the prefrontal cortex here in the front part of the brain. And it's that pathway that is associated with pleasure, with the experience of pleasure. And what happens in the brain when someone becomes addicted is that pathway gets hijacked. And an analogy, I'm not sure if this is what you were thinking of, Lynn, but the analogy I really like to use is when you think about how the brain, because I mentioned this notion that the brain changes its structure and function as a result of exposure to drugs. In the same way that our bodies adapt to anything that we do. For example, if you go down the gym, right, and you're working out of the gym, what happens? You build up muscle, right? So people take advantage of that because they want to build up muscle, right? So they go down there and they work all these weights. And so you build up muscles, okay? Now, in other words, your body adapts to the presence of these heavier weights, right? You wouldn't normally come across these heavy weights in normal life. And our bodies are very good at adjusting and adapting to what's thrown at it, right? So one of the things that happens with addiction, another analogy is music. Say if you really love a pop song, most people can identify with this, is that there's a song when you were growing up that you really loved, and you went and bought that record, or you downloaded that thing. I should say that.
Whatever you do nowadays.
I used to buy it. And you play it, and you put your headphones on, and you crank it up, and you just love that song, right? So you're playing it really, really loud on your headphones. Now, depending on how long and how loud you play it for, when you take your headphones off, and somebody speaks to you in a normal voice, it's hard to hear them, right? It's in part because your ears adapt to the high volume, right? So the abnormally high volume that your ears are exposed to, your actual ears will become slightly damaged, right, in the short term. And also, as a consequence, they'll become desensitized. So when somebody speaks to you at a normal volume, it's hard to hear. In the same way, the same thing happens inside your brain with regards to drugs and your dopamine system, which is the chemical that mediates your pleasurable experience from drugs. Because what drugs do, at high doses in which people like to take them because they produce this very pleasurable experience, they take a high dose and that produces an abnormally high release of this neurochemical called dopamine, right? So what does our brain do? Our brain actually says, this is way too loud. That's too much dopamine. So it kind of proverbially sticks its fingers in his ears. So what does the person who wants to get that pleasurable feeling do? We turn up the volume a little bit more, right? So you turn up the volume a little bit more and your brain says, wait a minute, that's even louder. Digs its fingers in its ears even deeper. So what happens is you continue that process is a losing battle. It's a divergent battle, right? So your brain's turning itself down, and the front part of your brain is saying, I need to do more of this because I want to get that good
Sure.
feeling back, so you take more and more to get the same effect,
Well
right?
put,
And that's
sure.
called tolerance or
Makes sense.
neuroadaptation. Now, the problem is that what happens when people actually stop using the drug, right? It's just the same. You take the earphones off, you can't hear, you can't hear people. Can you say that? Can you speak up a little bit? I can't hear you, right? Because your ears have become desensitized. What happens in the brain is that, because that's the pleasure mediator of the brain, you can't experience normal pleasure the way that you normally would, because now your brain has still got its fingers stuck in its ears, right?
Sure.
So it's going to be desensitized to normal levels of reward. And this is in part why it's so hard for people early on to stay off of drugs, and why relapse is very common early on. It's more common, obviously, early on than it is later on, right?
Yes.
Is because it's so hard for people just to experience just normal levels of pleasure, the same kind of normal level of pleasure that you would get from drinking a cup of coffee, a nice sunny day, meeting a friend, seeing a good movie. People who are recovering from addiction, they don't experience that. There's a sense of just
Looking for more to heighten it. I see.
And so that's why it's very, very tempting for people to go back to the thing that they know will produce that feeling that they feel that they need.
And it's really amazing when you consider that